Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything pain management related with education. Today I'm out at McCormick Ranch Park, which is a gorgeous area of Scottsdale with a park, with the lake, golf courses, resorts. You should come check it out. It's a beautiful area. The topic for today is risks and side effects of epidural steroid injections. So to start that, let me just mention the benefits briefly. They are big time. Epidural steroid injections have been done for sciatica since the 1950s. So for 60 years, they've been studied and looked at extensively. And the benefit has been shown to help 75 to 90% of patients. And it can help them with pain relief, continuing to work, getting to play again with their kids, and avoiding surgery. So the benefits are big. There was a study a couple months ago looking at professional athletes, and almost 90% of them were able to get back to playing professional activities without surgery. Very successful, okay? They're often done as a series, so if the first one helps a little bit, then the second and third can be done, and they can be repeated every few months, but you don't want to do them too much because, as we'll talk about in a second, the steroid has some side effects. So what are the risks? Well, it's a low-risk procedure, but it is not a risk-free procedure, okay? There's a risk of infection, which is much less than 1%, low enough so that antibiotic prophylaxis is not used like it is with like a knee replacement, okay? So that's a low risk. Obviously, the pain doctor will sterilize the area so that the area is free of bacteria where the needle goes in, but there's always that risk. There's a risk of some bleeding. If you're on an anti-clotting medication, such as Coumadin or Lovenox, please notify your pain doctor, because you will have to stop those a certain amount of time before. Even if you're on aspirin or anti-inflammatories, those will need to be stopped as well. So talk to your pain doctor about it to find out the exact time frame. Usually it's 5 to 7 days, but they'll tell you specifically the time frame, because you can get some bleeding around that area, and if it accumulates enough, it can start to compress on the nerve root, the spinal cord, and cause some problems. All right? Another risk is a dural puncture. The dura, D-U-R-A, is the area around the spinal cord that covers it. That's the name of the covering. And sometimes inadvertently the needle will puncture it. It happens, and usually it just seals up within an hour or two, and the patient doesn't have symptoms. But if it doesn't, the patient can get what's called a spinal headache, as fluid, the cerebrospinal fluid, can leak out. All right? So, I mean, we replenish our cerebrospinal fluid every 4 to 6 hours. So it comes back. It's like Doritos. If you eat them, they just make more, right? So, but if you lay down for an extended period of time, that can help. If it persists, the pain doctor may need to do an epidural blood patch. But if you notice that you're having severe headaches standing up and they get better when you lay down, that is often indicative of a spinal headache. You should notify your pain doctor and receive the appropriate treatment for it, okay? Such as drinking caffeine can help with the headaches, laying down, and whatnot, all right? Another potential risk is nerve damage. It is exceptionally unusual, but there are instances of paralysis from an epidural steroid injection. Sometimes the pain doctor will inadvertently touch the nerve root that they're trying to put the steroid medication around, and typically the patient will feel something, you'll say ouch, they'll just pull back a little bit, and they'll inject the medication, and then it just goes away. It may persist for a few days, but usually it just goes away, all right? Now, one of the unusually rare risks is cauda-equina syndrome, and this may be from bleeding after the procedure, but if you have loss of bowel or bladder function after an epidural steroid injection, notify your doctor immediately, all right? It's rare, but it does happen, so you should notify them absolutely immediately to get checked out. Let's talk about the side effects for a second. So side effects mostly come from the steroid medication, but the steroid medication works so well that it is right now the gold standard for an epidural injection. The sciatica or radiculopathy down the arm comes from inflammation. The steroid is a huge anti-inflammation. It bathes the nerve root with the anti-inflammation and often just knocks out the pain and is a godsend to a lot of patients, as mentioned. So, but you can have a temporary increase in blood sugar. You can have some sleeplessness for a night or two, some facial flushing, some anxiety, potentially if you're taking anti-inflammatories and you have a potential for an ulcer, if some of the cortisone gets in the bloodstream, and it does a little bit, it can contribute to you getting an ulcer. So you might want to take Zantac or Pepcid for a few days, to minimize that risk. All right. Other risks, you may have some, as I mentioned, some facial flushing, some local pain where the needle goes through the skin after the numbing medicine wears off. That may hurt for a little bit. It may have some numbness in the area, but usually those are all just temporary. Okay. So there you have it. The risks far outweigh the benefits for an epidural steroid injection. The pain doctors at Arizona Pain are board certified and fellowship trained at all of their locations, which basically surround the valley and serve Phoenix, Glendale, Scottsdale, Chandler, Tempe, Mesa, Surprise, Sun City, Goodyear, Avondale, Queen Creek, really the whole valley with the multiple locations. The phone number is 602-507-6550. So 602-507-6550. If you're having severe back pain, neck pain, sciatica, which is pain down the leg, radiculopathy, pain down the arm, if you're having extremity issues, RSD, they are experts in a lot of these conditions and offer comprehensive treatments, not just pain interventional procedures, but also medication management. There are chiropractors at every location, physical rehabilitation, spinal decompression therapy, acupuncture, massage, and they take most insurances. They do self-pay, personal injury liens, workers' compensation, and they take some of the access plans as well. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.